Welcome to the Dairy News and Views podcast, a production of the Iowa State University Extension and Outreach Dairy Team. Our podcast covers current educational, research, and industry tools available for your operation to manage healthy cows and calves while producing the highest quality dairy products. Thanks for joining us today on Dairy News and Views from the Sioux Dairy Team. I'm Jen Bentley, Northeast Iowa Dairy Field Specialist, and today I'm here with my Extension Dairy Team colleagues, our State Extension Veterinarian, Dr. Phil Jardin, and Fred Hall, our Northwest Iowa Dairy Field Specialist, as we discuss today's topic surrounding dairy farm worker health. So welcome back to the podcast, Fred and Phil.
Thank you, Jen.
It's great to be back, and I'm looking forward to today's discussion on how producers and employees can safeguard their health on the farm.
Yeah, I think we got a great topic, and we got a few people joining us here today. So we're happy to have on the call with us Terry Boss, the Director of Community Health Services, Community Health Partners of Sioux County, and then Dr. Andrew Henenfrent, State Public Health Veterinarian with Iowa Department of Health and Human Services, as they share some of the information for our dairy farm workers to help us be more aware and prevent and, be proactive in our healthy measures. So thanks for being with us here today, Terry and Andrew. And before we get started kind of diving into the topic, why don't you just give our audience a little background about yourselves?
All right, I could start. So I'm Terry Boss. I'm the Director of Community Health Services here at Community Health Partners. We are the Public Health Department for Sioux County. And I have been a public health nurse here for over 10 years and born and raised in Iowa. So very familiar with the agricultural landscape of Iowa, but also very connected and very passionate about the health of Iowans as well.
Yeah, I'm Andrew Henenfrent. I'm the public health veterinarian for the state of Iowa. I'm from a farm in West Central Illinois, was born in Burlington, Iowa, went to veterinary school in Illinois, and then traveled around for a bit, came back to the Midwest, worked at the Iowa Department of Agriculture for a couple of years before switching over to public health. So happy to be here today, and thanks for having me.
Harry, while avian influenza is at the top of everyone's mind, there are lots of other things out there that we need to be thinking about. Kind of give us an overview of some of those other things.
Well, in terms of health and other things to be thinking about, besides avian influenza, we've had a really active influenza season, and especially influenza A here in Iowa. We've had probably one of the highest levels of influenza in Iowa in about the last 15 years or so. And so that's one of the things that we have been watching in healthcare. And Iowa, our influenza vaccination rate goal in the state is to have about 70% of Iowans vaccinated. We're actually at about not quite 32%. So we're kind of falling short of that and that protection measure. But influenza has been a big one this past year. Of course, COVID-19 and other respiratory viruses always around, as is the RSV virus. So those are a couple that we're keeping an eye on that have been pretty active this year.
You mentioned the rate. I know herd immunity is part of the livestock thing. Is that true in humans?
Yes, it is. And that's where we set some of those vaccination rate goals, because where we base those goal rates on how we can reduce the spread in communities. So for influenza, we've set a 70% goal for the state of Iowa, and we do fall pretty short.
Let's go ahead and shift gears, and maybe, Phil, can you give us a brief overview of H5N1?
I can, yes. So it's almost been exactly a year ago. Today's March 21st. It was last March 25th or 26th when it was announced that avian influenza was in dairy herds, which was a new thing at the time. We'd been dealing with it in poultry flocks for years, but that was new to the dairy industry. It started being reported in Texas. Texas, New Mexico, and Kansas were the first states to report it. And then pretty quickly it spread to some of the other states. Hopefully right now we're on the tail end of that. The only states that are positive right now are some of the extreme western states, but it got to California in August and really played havoc there in their industry. But from a human health standpoint, it is a zoonosis, and there have been reports of dairy workers getting conjunctivitis. It's usually pretty mild, but there are concerns that, possibly there could be mutations, especially if a human or a cow gets infected with a human strain and the cow or bird strain at the same time. There's some reassortment that goes on. So we'd encourage people to at least think about getting vaccinated and talk to your doctor about whether it's a good thing for you to do.
When you said vaccination, is that for influenza? Is that what you referenced?
Yes, yes.
And I know since, the High Path has started a year ago, there's been some really great resources for biosecurity measures for farms and just overall protection for dairy farm workers. Terry or Andrew, do you want to kind of explain what some of those resources are?
Andrew, I'll let you take that one.
Yeah, no problem. So we're always working with our agricultural community, especially our livestock producers and dairy producers in Iowa to help them improve their biosecurity. The strategy that we're taking on that is to help reinforce that worker health, worker safety, and on-farm biosecurity all go hand in hand with each other. So the same steps that producers are going to take to protect their animals from getting diseases from other farms or from other animals, or maybe the feed truck coming on the farm, are the same things that will also help protect their workers from getting any potential germs or diseases from their animals. With avian influenza in particular, as Phil alluded to earlier, there's been 70 human cases in the United States to date. Most of those have happened in California and have been associated with dairy workers that specifically working in the milk parlor. Phil can get into a little bit more of the details behind this, but essentially the milk coming from infected dairy cows is very hot with virus, so very concentrated. So what we really stress with our dairy workers is when there is an issue on the farm, that milking parlor is the highest risk of exposure. And the most common ways people get exposed is if they get virus directly in their eyes, their nose, or their mouth. So just any steps they can take to protect their eyes and nose or mouth from getting exposed. So it's the same type of principle that you'd see in the general community if you've seen prevent seasonal influenza signs around schools or daycares or your local pharmacy. So some of those same general principles. So we try to relate to what people already know and do on a daily basis to adapt to any new situations or anything else they may have to face on their farm.
So Phil, maybe you want to just cover that a little bit. I know there was questions about how the virus was spread and where it's found.
It's really interesting where this virus is found. I mean, it's got the word avian right in the name, and chickens don't have udders, but that's the only place we find it reliably in infected dairy cows. So it is shed in the milk in very high numbers, like Andrew said. And so we know probably that is the highest risk of exposure is with contaminated milk. Now, how it gets into the next animal or how it gets into the human, that's not as well worked out, but it kind of makes sense that it's, especially since it causes a conjunctivitis, that it's, like Andrew said, it gets out through the milk and into the human workers through contact with their face, their nose, their mouth, or their eyes.
Philip, we've talked about the dairy cows and the poultry, but they're not the only animals that have been affected. In fact, there's kind of an interesting story that goes with farm cats, right?
That's correct. There's a wide range of animals that can be affected by this. And the one that's kind of front and center of this conversation is farm cats. There have been farm cats on dairies, both the feral ones that are kind of just come up to be fed because they know there's mice and milk that the milkers are going to give them there. But also there have been reports of the workers and the farm owners' pet cats becoming infected. And it's not a good thing for a cat. They end up they get a pretty bad brain infection and meningitis, and it can be very deadly to a cat.
And I can add a little bit to that too. So what I'm talking to my colleagues in other states and at the national level, there's not as much information on cats as there are livestock species because they're not a production animal. So there's not the intricate health records and tracking and vet visits that always go along with that. But the through line seems to be cats that develop illness from avian influenza are those that have drank milk straight from the cow or have hunted wild waterfowl that have died from avian influenza. And then there's been some instances of cats getting it from raw pet food too. So it's not a substantial risk to your average cat that's out there if you're an Iowan that has a house cat or you don't have any interaction with dairy farms or poultry farms or anything along those lines. But the biggest thing to avoid for our everyday Iowan would be just to make sure you're feeding a commercial processed cat food. Just like with people, there hasn't been any food safety concerns that have been highlighted from either pasteurized dairy products or poultry products that are cooked properly. So all those safe cooking standards that have been established for decades and decades now will inactivate, kill the virus. So same things that you'd use to protect you and your family are the same things that you'd use to protect your pet cat.
Harry, you can maybe start this conversation. We've talked about the personal protective equipment or PPE. Can you kind of go over the recommendations, and then are there programs to supply PPE for farm workers?
Sure. So it is really important for our farm workers to be wearing PPE. We now know that probably 60 to 75%, somewhere in that vicinity, of all of our emerging infectious diseases in humans are due to pathogens that come from animals. And really, as our modern food production that we see in our dairies and our poultry farms and so forth, that modern food production makes for a lot more intense human animal contact than we've ever had before. So that is where some of that personal protection becomes important. So things like a mask, eye protection, especially as we think about, we were just talking about milk splattering into the eyes or the face, because that's of course very high in viral particles if we have an infected cattle. So mask, a face mask, eye protection, gloves. And then we also think about things like, depending on the job, maybe some waterproof apron or coveralls, gloves, boots. And of course, as we wear this protection, always thinking about putting it on, taking it off safely, disinfecting it after each use. But those are the reasons that those things are important and become important, is because we are having so much more intense contact with animals.
And I'll add to that a little bit too. So just as producers think through this, just think that a lot of those steps, so the dedicated personal protective equipment or other clothing that they might wear on a farm, that same stuff that's going to protect them will also help to stop any pathogens from spreading from their farm to another farm or from another farm to their farm. So it is very serendipitous of how it all interlinks. And then when I educate folks, especially kiddos, around different diseases that can go from animals to people or from people to animals, I always say that germs aren't magic. There's only so many ways they can spread. Some are respiratory, some aren't. But in general, the number one thing that people can do is practice good hand hygiene, good hand washing practices. Germs are everywhere in the environment. There's even more germs in animal poop. So even more reason when working with animals to have those different hand washing stations or just places where workers can more easily practice hand hygiene than they would in another setting.
We've kind of been drilled down on our farms and our employees and our producers. Let's step back to the 30,000-foot level and kind of give us a picture of what's happening worldwide, not maybe just on H5N1, but on a lot of zoonotical in the world. Andrew, you want to tackle that?
Yeah, so anywhere where there's lots of interaction between people and animals, there's a risk for disease spread, not just from animals to people, but also from people to animals. Germs don't discriminate. So if they have a viable host where they can cause an illness or start to reproduce, they're going to do so. With the interconnectedness of our world now, it's easier for different germs and diseases to start in one area and quickly get to other areas of the world. But the general steps that we take, and as Terry alluded to earlier, a lot of our emerging diseases now are animal in origin. So just the number one steps that we take is recommending just those good animal husbandry practices that go along with food safety, so proper cooking temperatures, food preparation, everything along those lines. And then working with our agriculture partners, keeping a close eye on any of those international diseases that might be more prevalent in different continents or other areas of the world, and monitoring those for incursion into the United States.
Well, I have a question for Andrew on just the general things that he sees in his day-to-day job. What are some of the diseases that the zoonosis that you encounter here in Iowa?
So probably the number one thing that we focus our efforts on, and is not always on people's top of mind, but is a good example of how a combination of good animal health and public health interventions makes a huge difference in the long run, is we still deal a lot with rabies. So while rabies has largely been brought under control in the United States, there's still about 2 to 3% of bats that carry rabies just naturally. So there's still kind of a low level of folks getting exposed or their pets getting exposed. But as I said, through the combination of efforts in the past and vaccinating pets, that's been largely brought under control, but still something that we have to keep an eye on. On the agricultural front, one of the things that we see pop up every now and then is Q fever, so Coxiella burnetii, especially in our smaller ruminants, so that can cause pregnancy losses in small ruminants and dairy cows and beef cattle in some instances too. But it's talking the producer and the veterinarian through how to handle those situations, how to protect themselves, and steps to take if they start to become ill or have any questions about their specific health.
Thank you.
And do you have some resources that we can guide our producers to learn more about maybe some of those zoonotic diseases, to just be more aware of those potential spreads and ways that they can prevent those spreads?
Yeah, we're starting to build out additional resources. Right now, we have quite a few resources around rabies, and we have some resources on prevention of novel influenza, so avian influenza on farms and between farms and people as well. But yeah, keep an eye out on those. We're starting to further expand that, but we still have our tried and true general resources and everything that apply to any settings, such as just preventing seasonal influenza. We've got some signage that I would imagine everyone's probably seen out there that's been pretty popular, but we've recently modernized that. So we have all kinds of stuff, and I'm always open to requests from producers and groups or associations for specific resources that they'd like to see that I can make happen for them.
I know one resource that I refer producers to often is the Center for Food Security and Public Health. I think it has a lot of good materials, just easy to interpret, and there's some signage that they can print off talking about zoonotic diseases or just overall farm security, biosecurity. So that's another one that I always refer to producers to as well.
Yeah, I like I like that, Jen. That's one of my favorites too. I like the pictures they have because when we talk about biosecurity on dairies, especially with this avian influenza, what one person considers clean in their trailer that goes between dairies might not be what other people consider clean. And they have pictures in there that show what we kind of mean by clean. It doesn't necessarily mean just taking off the big chunks of manure.
And the Iowa Department of Agriculture and Land Stewardship has a pretty robust biosecurity webpage as well. One resource we have at the Iowa Department of Health and Human Services on the human health front is we have a very nice webpage with lots of resources that can be pulled down and printed that I actually developed with that group at Iowa State you were all just talking about, that specifically deals with respiratory fit testing and respiratory health. And I purposely had that designed so it can be used in any setting, not just human healthcare settings, but on farm settings too. So it can show anyone how to fit test, select a proper mask for respiratory protection, the whole 9 yards. I tell people it does everything but supply the kit for you to do it. So I can share that link if you want to put that in any show notes or post it anywhere else for after today's broadcast.
And I would be somewhat amiss if I didn't mention the Iowa State Dairy Team website. Jen does a fantastic job of keeping one of our tabs extremely current with updated information, not just on HiPath, but on a lot of these biosecurity things we've been talking about.
Terry, do you have a website too we can put a link to for services in Sioux County?
Sure. So our website for our public health department is SiouxCountyCHP.org.
Very good.
And Terry, I'd assume, if they're not living in Sioux County and they're in a different county, like I'm in Winneshiek County, I'd be able to call my public health in Winneshiek County and get the same type of resources.
Yes, absolutely. You could, whatever county you're in throughout Iowa, there is a public health department there that would be able to point you to resources, would be able to answer questions, or would be able to find answers to those questions that you might have.
I know as part of our dairy days this year, a lot of our county public health was at our programs and offered, some free health screenings. And I thought that was great, a good partnership of getting our dairy farms connected with those contacts.
Absolutely.
Yeah, that was great. They did more than just the vaccines. They also checked blood pressures and glucose levels. So it's more than just the infectious disease part.
Yeah, and in Iowa, we have 99 counties and almost as many local departments. But just want to highlight a partnership that Iowa HHS has undergone with our local partners. And Terry and her team have been a wonderful partner on this. We have made seasonal influenza vaccinations available to dairy workers. That was expanded to poultry workers as well. And we're going to continue that for next year. And that's going to also expand to swine workers. And we made that available to any county that wanted to participate so that those folks could swing by and get free vaccinations with 99 different counties. That looks a bit different in each county, but the easiest way for a producer, someone that's interested to find out about that, and this would be the same way for them to find out about any other resources their local health department can provide for them, is to Google their county's name followed by health department. That'll usually get you to the right place. If someone's ever in doubt, they can always reach out to me. If it's for our listeners in Sioux County, contacting Terry's group directly would be the best route for that. But always want everyone to know that their local partners are always there for them and more than happy to help.
And I want to kind of add to that a little bit of the role of flu shots and the seasonal influenza vaccine, because we've got two different strains of influenza here that we're talking about today. We have the human influenza and we have the avian influenza. Human influenza, of course, has the ability to pass from person to person. Right now, avian influenza, we're seeing it pass from animals to humans, but it does not have the ability to pass from human to human at this point that we know of. And so the reason that we are really looking at promoting people getting their flu shots is because one thing that is a possibility is people can get infected with both human influenza and avian influenza at the same time. When that happens, because influenza A viruses, they have the ability to swap segments of that virus. And then what happens is we increase the chances of turning it from just not being able to pass from person to person to maybe when segments are swapped, suddenly it mutates or the virus changes and it has that ability. So while the seasonal flu shot doesn't protect directly against H5N1, the avian influenza, what we're looking to do is if we're protecting ourselves against that human influenza, maybe we're going to be able to stop that virus from mutating and changing so that we don't see it passing from person to person.
That was very well stated, Terry.
Yeah,
Thank
thanks
you.
for highlighting that.
Yeah,
Thanks for highlighting that, Terry. But yeah, I to further expand on that, I like to explain it as it's kind of like a game of rock, paper, scissors. So is those viruses, and there's no malicious intention or thought behind them. They're just little pieces of genetic material, but if they undergo any of that, it's kind of a game of chance. So it could make a virus that's weaker, just as the same as the virus that started, or more, or a stronger virus. And that could be where have an impact on people or animals. So it kind of, again, is serendipitous with those good husbandry biosecurity practices.
I think Terry and Andrew and Phil, you've all brought some really good topics to the surface today. And I think just creating some awareness of, what dairy farm managers can do for their employees and dairy farm workers as far as protection and prevention, just being proactive, and just overall general health is important to our dairy farm workers, because we know that labor is always limited on farms, and we want our employees to be the healthiest that they can be on the farms. And these are ways that we can offer some benefits to those people, just to make them safe and make them healthy, and continue to provide the best quality product that we can for our dairy industry as well. So again, I want to thank you for being on the call. And any last comments any of you want to share?
I'll just say thanks again for having us today. It's greatly appreciated, and just want to stress one more time that if our dairy producers or any other listener out there, any questions, health concerns, anything related to influenza or not, that your local health department, and especially in Sioux County, Terry and her group, they're a wonderful resource, and truly just there to help you and be a resource for you. So don't want to stress just to feel free to reach out anytime, and that they're always more than happy to help.
And
Yeah,
I will second that. Oh, sorry. I will second that. As a public health department, that is our goal, is, keeping our county healthy, and we want to be a resource for everybody in our county. Coming from an agricultural community, this is something that we are watching very closely. So my message to, our dairy farmers who are listening in is, with this H5N1, stay informed, stay prepared, and be proactive with what health measures you can be proactive with.
And I'd like to point out that this virus is fairly easy to kill, very easy to kill with heat. So if your pasteurized milk from a store is very safe, we don't have to worry about that. And then also I want to thank the producers as we come up here on the anniversary of this outbreak, the producers and veterinarians in Texas, New Mexico, and Kansas for being transparent and forthcoming back when this outbreak was happening. We've learned a lot this last year, and I think a lot of it's because they were open and willing to come up with the diagnosis, and it's helped us a lot as an industry.
Well, thank you all for being on here today, and want to thank our audience for joining us today. And we look forward to visiting with you on the next Dairy News and Views from ISU. This institution is an equal opportunity provider. For the full non-discrimination statement or combination inquiries, go to www.extension.iastate.edu/diversity/ext.